assistance with New Year's resolutions, and stay tuned for a special announcement. This is the Regional Health Report. Welcome to the Regional Health Report for January. I'm Ann Krebs. It's the beginning of a new year, and for some, that means resolutions. Eating healthier, exercise more, and lose weight are always in the top 10. Fortunately, Army Medicine has just the place to get you started working on your goals, the Army Wellness Center. The centers provide programs and services designed to improve and sustain healthy lifestyles. We learn more from Fort Drum, New York.
A weight management appointment starts with a questionnaire. Weight is recorded, and the client's body composition is analyzed in a state-of-the-art machine known as the bod pod. This egg-shaped machine will read the client's muscle and fat percentages, print out a report, and then it's time to talk to the health educator.
Really just trying to improve the overall health of the Army community so that we can prevent any chronic issues as they get a little bit older, whether it be, injury risk for your active duty or just overall health as we age, the cardiovascular disease, the diabetes, the high blood pressure, and really just trying to prevent all of those things.
It's not intimidating, they don't preach, they don't judge. They just give you, she prints out a piece of paper, here's the facts.
Weight management is just one of the services the Army Wellness Centers provide.
Yes, we do have a lot of people that come in that want to lose weight, want to lose body fat, but it's not necessarily the only thing we can do. We can also help with performance improvement, whether it be improving that 2-mile run time or working on exercise prescriptions so that you can meet some of your goals for the new APFT. It could be also sleep related, or maybe you struggle with stress and stress management. And so it really just kind of depends on what your goals are or what kind of services you might want to do here.
The centers use Army Medicine's Performance Triad to provide guidance to proper nutrition, sleep, and exercise.
Ultimately, the performance triad is, you could think of it as a circle. One of those things, your nutrition is going to affect your activity levels, which could then affect your sleeping habits, which then affects your nutrition habits. And so it's trying to marry those things together, and then the Army Wellness Center is essentially supporting all three of those. It's all about what you need in this moment. It's not what you might need 6 months from now or what you needed 3 months ago. It's whatever you need right now so that you can be the most ready and resilient soldier or the most ready and resilient family member or civilian employee.
The Army Wellness Center is open to soldiers, family members, retirees, and DA civilians. For a center near you, click on the link in the description below this video. Blanchfield Army Community Hospital staff made the holidays a little brighter for the children in the local communities around Fort Campbell, Kentucky. Maria Yeager brings us the story of caring.
While most people think of Santa in a big red suit, sometimes he wears green. Soldiers and civilians from Blanchfield Army Community Hospital gathered early before clinic hours for some holiday fun. They turned in toys and new clothes to a Clarksville, Tennessee charity that will distribute the items to families in the community who need assistance this holiday season.
We're doing the Angel Tree for just a charity for our local community, just trying to give back to some of the local families in our area that, that we could just give something to, a little bit of happiness, joy in the morning when they wake up on Christmas. And it just brings a joy to all of our hearts that we can actually do something like that. And it's really important for our organization.
We had participated in this last year as a group. It's all voluntary, and it was something that we can do together to give back to the community.
We just volunteer for it. We just put it out there, and anybody that wants to voluntarily go and get an angel, or if their clinics decide that, hey, we want to sponsor some for the clinic, then anybody can chip in if they want to. It just makes me feel good inside.
The giving is not limited to the holidays. The team from Blanchfield likes to reach out to the community year-round.
We have what we call Fifth Thursday, and we do various different things for the community. We've done things for just the local schools, so this was one of those Fifth Thursday sort of projects that we did.
The event provided busy staff an opportunity to give back to the community many call home.
In other news around the region, soldiers from Wynn Army Community Hospital in Fort Stewart, Georgia, traveled to Naval Hospital Beaufort in South Carolina for the inaugural 2019 Low Country Army-Navy Football Championship. Besides service bragging rights, the game built bonds between the soldiers and sailors who played, as they will work more closely together when both medical facilities transition to the Defense Health Agency. Zach Renstrom reports the story.
Starting with the head coach, Mr. Dwayne Cox from Hampton, Virginia.
We had a meeting with the Navy leadership.
And now for your players that are out here today.
And our leadership, they gave us the idea and we ran with it. So we had a few weeks to put together a team, do a couple of practices and get these uniforms. We had a smaller team to work with compared to the Navy, but we were just playing both sides of the ball. Everybody had multiple positions. I think that played a factor into how the game went.
I'm truly proud of my soldiers that came out here today. When you talk about the warrior spirit, these soldiers came out here and they left it on the field.
Events like this really build camaraderie and teamwork. If we go down range with these guys and we link up, that bond that we created today is just going to help us down the battlefield and save lives together.
We're going to lean on each other and support each other because at the end of the day, it's a competitive game. Both teams want to win, but we're one team. We're talking about future operational readiness and forging those partnerships and that operability at multiple tiers within our respective commands.
From start to finish, this was an epic event. I'm not going to say it was a game, it was an epic event. I'd like to thank Naval Hospital Beaufort for inviting us out here. We'll get them next year. Our soldiers, they don't have any reason to lay their head down. They did an outstanding job out here and I'm extremely proud of them.
The winners of the Cadre Awards of Excellence for the Warrior Care and Transition Program are out. Fort Stewart's awardees are for Social Worker and Best WTU. The Platoon Sergeant and Human Resources winners are out of Fort Campbell, and the Squad Leader awardees come out of Fort Bragg. And finally, we here at the Regional Health Command Atlantic have our own New Year's resolutions. The Regional Health Report is changing from a monthly format to producing individual stories. This will allow us to deliver more timely content throughout the month. We are committed to keeping you informed of all the wonderful work happening at all of our medical treatment facilities and other units within our region by giving all of you a glimpse into the lives of our soldiers staying ready and providing access to safe, quality health care with their civilian teammates. Thank you for letting us into your homes and on your mobile devices for the past 5 years. We are excited about the transition and hope you continue to enjoy the stories on readiness and healthcare from Army Medicine's largest health command. That's the Regional Health Report, a highlight of health and readiness across the region. Don't forget to check us out on your favorite social media sites and on iTunes. And be on the lookout for new content with eye on readiness and focused on healthcare. Thanks for joining us.